Hello and welcome back to Medical Today with me, Gerard Ratnam. We just spoke about supplements a while ago and how important it is to make sure you have good levels at all times. From there, we move into urology, and we're going to be talking about urological care for patients. Now, urology is a surgical specialty that apparently deals with the treatment of conditions that involve the male and the female urinary tract and the male reproductive organs. Now, joining me in the studio is Dr. Rajeentheran Suntheralingam. He's a consultant urologist and a urological surgeon from KPJ Damansara Specialist Hospital to give us an insight as to what he does. Now, my first question to you is about spinal cord injury. We were meant to talk about urology and urological problems, but we're talking about spinal cord.
Yes, thanks, Gerard. Now, it's quite interesting, many people don't realize what's the relationship between spinal cord and something down there. But in fact, spinal cord actually is a relay system from the brains, and actually controls many other things. It controls your bowel, it controls your bladder, it controls your movements of your body, it controls many other things. And many people don't realize that once you have a spinal cord injury, it takes over the function, it removes the function of other organs. And one of the organs that is affected is bladder. And if one does not look after the bladder well after spinal cord injury, they can actually succumb to kidney failures as well, because the bladder may get very distended, kidney may get very swollen, and this is very important morbidity and mortality for as far as spinal cord injuries are concerned.
So before we get into conversation, my second question to you would be to tell the difference between a paraplegic, a quadriplegic, and a tetraplegic, just so we know what we're talking about.
A paraplegic is somebody who cannot move both the lower limbs of the body. That means both the legs is completely paralyzed. It can either be paraplegia when it's completely paralyzed, or paraparesis when there's weakness of the limbs. Now, tetra and quadri are the same thing. It means four. So tetraplegia and quadriplegia is the same term. That means you cannot move both your upper limbs and lower limbs. That means the legs, hands cannot move at all. Then we call the person as the condition as tetraplegia or quadriplegia. And when there's weakness, we consider it as tetraparesis or quadriparesis.
Right.
So they're actually the same terms.
Right. So now with all these problems, we know that people with spinal injuries or spinal cord injuries will suffer from some kind of urological problems. What are the main problems you see, or what are the main causes or symptoms that present themselves when someone is become a quadriplegic, a paraplegic, or a tetraplegic?
See, once when the spinal cord injury has occurred, they actually go into what's known as a spinal shock. There are about 3 to 4 stages of a spinal shock. They become completely paralyzed, lose all their reflexes. And then after a few weeks, they gain back the reflexes. Then only we can determine how bad this paralysis is, whether it's due to a complete spinal cord injury or is due to an incomplete spinal cord injury. Now, it's very important to determine this. So what the spinal surgeon or orthopedic surgeon does is they actually evaluate the patient, assess the patient that time itself, and determine by what is known as ASIA or Asia grading system. It's determined as Asia A, B, C, D, or EE, which is normal.
A, B, C, D, or double E?
Or E. E alone.
Okay.
Now, based on that, they will know whether this patient has got, they have to determine whether this is a complete spinal cord injury or an incomplete spinal cord injury. But incomplete spinal cord injury, they can present in different ways. They can present as a sensory loss, a motor loss, the extent of the motor loss, and so forth.
Right.
Now, the odd thing about the bladder is, you see, when we talk about the bladder, when the person wants to pass urine, there are so many other functions that you need to talk about. Whether the bladder has to be normal, and the sphincter which controls the urine has to be normal. Normally, when an individual wants to pass urine, the bladder has to contract, the sphincter has to relax.
The bladder has to contract and the sphincter has to relax.
Okay. After passing urine, they have to hold the bladder. The bladder has to be relaxed, the sphincter has to be contracted. Now, anything other than this is already a disorder of the bladder. So, the disorder of the bladder can either be uncontrolled contraction of the bladder or completely relaxed bladder. At the same time, an uncontrolled contraction of the sphincter and a completely relaxed sphincter. With this, you can have different permutation and combinations. A completely contractible bladder with a contractible sphincter as well, or a contractible bladder with totally relaxed sphincter, or a relaxed bladder with totally contracted sphincter, or a relaxed bladder totally contracted, totally relaxed sphincter.
Right. It's very confusing, but
yes,
that's a lot of information there.
In fact, we use this term synergy, where when there's contraction of the bladder, the sphincter has to relax. When the
so it has to work in concert.
Yeah, it has to work in what's known as synergy. Now we have to determine, in these cases with spinal cord injuries, we have to determine whether this patient has got a problem with the bladder and the sphincter.
Right.
And what is the relationship, and what type of bladder and sphincter problem we are dealing with. So we have to actually assess, go through the history, go through the examination. We do some X-rays or CT scans or MRIs.
Right. But I guess if you're dealing with someone who has a spinal cord injury, it's either an overactive bladder or an underactive bladder.
Yes. It's either an overactive bladder or underactive bladder, but it's not as simple as that. You can have an overactive bladder with overactive sphincter, overactive bladder with underactive sphincter.
Right, so the technicalities can vary quite a bit.
Okay. Why I'm saying this is because when we assess the patients, it's not only just thinking of whether it's overactive or underactive. We have to ensure that we are dealing it properly, because the treatment will differ. So finally what we do is we do what is known as a Eurodynamic Test, where we use pressure catheters into the rectum and into the bladder. Then we determine the function of the bladder.
Pressure catheters are put through the rectum and the bladder.
Okay. Yes.
And how does it work then?
And then we fill up the bladder with some saline solution. We see the activity of the bladder. Based on the activity of the bladder, we can see pressure movements. Normally when we fill up the bladder, it should be known as a stable bladder. In other words, there's no pressure rise. There's hardly any pressure rise. The bladder expands well. When there's overactivity, the bladder suddenly becomes very unstable. The pressure starts rising. The pressure starts oscillating. It starts fluctuating.
Right.
Okay, and then we know there's something wrong with the bladder. At the same time, we put EMG, which is known as electromagnetic electrodes, or surface electrodes over the bottom area. Right. And we can see the sphincter activity as well.
So you're using surface electrodes.
Yes, yes. And then we can know the relationship. There are two phases. One is a filling phase, where we fill the bladder with saline. We see the reaction of the bladder and the sphincter. And then is a voiding phase or passing urine phase, where the individual passes urine while the catheters are still in place. Right. And then we'll determine whether it's a very high pressure bladder or low pressure bladder, and whether the sphincter takes it or not. Right. So because of this, we can have different presentations of bladder. The person can have a very overactive bladder, always rushing and passing in urine, or they can go into retention. Then the bladder is very full. Very distended.
And that can back up into the kidney.
Yeah, that can back up into the kidneys. And then they can also present with a very full bladder, but when they cough, suddenly all the urine comes out because the sphincter is not working well.
Right, so that would be incontinence, yeah?
Yes, incontinence, which is leaking of the urine.
Right, so these symptoms can present itself in someone with spinal cord injury, but let's talk about the normal person who starts having, say, incontinence. I think that would be a problem for seniors, or some of us, with bad luck, we get it in our 40s and early 50s. Yeah. What can be done about this? Okay, so
basically when you have incontinence, it's actually leaking of urine. It may be a simple topic, but actually there's so much more details in it. When a person leaks, we need to...
It's also embarrassing,
Yes, it's also embarrassing, and many patients will not come and meet us for it. They will try to use pad or Pampers or something like that. But it's very important that for us to know that the longer we live, we need to live with a quality of life. It's not just a quantity alone. So these people who leak, they can leak due to various causes. They can leak due to a bladder which is too overactive. So before they can reach the toilet, before they can open up the door, suddenly the urine comes out. Or they have to quickly rush in. Okay, let's say for example they are on the road, on the highway, they can't reach to the restroom, they have to stop by the side of the road and just pass urine. So that is due to too much of overactive for the bladder, and the urine comes out. Sometimes there can be a retention due to prostate compression or prostate enlargement.
Oh, let's not go there yet, because I want to come to that topic very, very soon. Yeah, there's a few misconceptions with regards to that. There is, we'll come to that. So sometimes it's related to that.
So that is known as overflow incontinence. Same thing like a glass of water. Right. You pour in a water, it's too much overflow, it starts leaking out. So same thing, sometimes you can get an over distended bladder. The bladder is too full with urine. and it just invariably just comes out. That's known as overflow incontinence. Then
Right.
we have such thing known as stress incontinence. A person is normal. The bladder is completely normal, but the sphincter which controls the urine is a bit weak. So the person coughs, and suddenly the urine comes out. That's known as stress incontinence.
And this presents itself a lot from what we understand, and from what I read, a lot of women have
Yes,
this
a
problem.
lot of women, especially in multiple pregnancies, or if there's an obstetrical injury, let's say they're doing some procedure or something like that, and there's some amount of injury, then they can present with stress incontinence. Some of these spinal cord injuries which affect the sphincter can also present with the same thing. So that when they cough, they suddenly come out.
Right.
Now there's another thing known as functional incontinence, very important. It's not mainly due to a bladder or sphincter problem, but it's due to an elderly who cannot reach the toilet in time. Let's say you're now full bladder. You can always walk fast to the washroom, right? In an elderly person with so much of osteoarthritis, they cannot reach the toilet and suddenly the urine comes out.
Right.
This is not bladder or sphincter problem. It's due to the condition of the elderly person in reaching the toilet in time.
It's interesting that all these stories are making me want to go to the restroom now.
Oh yes,
for some reason.
So with me as well. Now that means you have overactive bladder.
Okay, so the third one was functional incontinence.
Yes, yes.
So with all these bad stories you've given us, is there a light at the end of the tunnel for
Yes,
people?
there's always a light at the end of the tunnel as far as urology is concerned.
This is really okay. I like the fun in it, but okay. So what can you do treatment-wise?
Okay, treatment-wise. Okay, first we have to determine what we are dealing with, and very important to know it's a bothersome score of the person. Let's say, for example, we have a normal individual. Retired, 65 years old man, retired, you're just sitting in the house doing nothing with your grandchildren. You have to pass urine 1.5 hours. Everyone, you have a washroom by your side. You just go to the washroom and just pass urine and then watch and drink your coffee and watch a movie or something like that.
Right.
But if you're a CEO or managing director, you have to attend long meetings, you're in parliament or something, you cannot expect to just walk away every 1 hour, 1.5 hours to this thing. So that is known as a bothersome score. It has to be bothersome enough. So when you deal with overactive bladder, you have to decide whether that individual has got bothersome symptoms or not.
Right.
Then they can pass urine quite often, but it's not bothersome, it doesn't need treatment.
Right. If it's bothersome, then you look into the different modalities available. Yeah.
Now, it's very important to know this. Overactive bladder is not a disease or a disorder. It's a symptom complex. Tuberculosis is a disease. Malaria is a disease. But overactive bladder, the term has been coined for such symptoms which is bothersome, indicative for us so that we can start treating them. Okay.
But we've also misconstrued it as a disease.
And I always speak to my patient because when they read the internet and they see, oh, they're passing urine more than 8 times a day, they get very panicky. But this is a qualitative disease, not a quantitative disease. Quantitative disease means like you have a cardiovascular problem, a heart problem, or stroke, or something like that. Your length that you can live is very much less. But this is a qualitative disease. You still live to the same age, but you want to make sure you live with quality. Now when it comes to overactive bladder, once we have diagnosed overactive bladder, very important, overactive bladder is a very specific term to denote any bladder overactivity with no known cause. In other words, you have a tumor, it's not known as overactive bladder. If a tumor means it's a tumor with excessive bladder activity or stone, they can present with
tumor with an excessive bladder activity.
Yes. So overactive bladder is a diagnosis of exclusion. You have to first exclude everything. The person cannot have blood in the urine, the person cannot have stones, the person cannot have infection. Some patients present with infection and they have this bladder overactivity, but this is not known as OAB or overactive bladder. So we have to rule that out.
So when you say infection, does it also mean the urinary tract?
Yes, urinary tract infection.
Right.
So once we have already established this diagnosis of overactive bladder, then we have got treatment. It's known as anti-muscarinic or anticholinergics. They work quite well.
Right.
We start them on a tablet. It's once a night, and then we assess and see whether the symptoms have improved. If it doesn't improve, we can top it up.
Right.
Top it up to a higher dose, or we can add in another medication known as beta-3 agonist, which is actually known as mirabegron.
Right, a beta-3 antagonist.
Only if they don't work, Then we have got intervention in urology. You'll be surprised what intervention we use. We use Botox injections into the bladder.
Right, right.
Now,
it sounds very painful, but I'm sure you have a handle on this.
Many people will think that when we inject some Botox in the bladder, we're going to make the bladder more cosmetically more
no, but we all know it's to strengthen.
Actually, to relax the bladder. So bladder is overactive. You know, some people do the Botox injection.
So you can't actually go on a date and say, hey, take a look at my bladder.
Okay. So you see, same thing as you're removing the wrinkles, right? You're going to remove the so-called wrinkles of the bladder. Okay, so you're going to make the bladder very relaxed. But that's only temporary. It lasts only 9 months. 9 months. But these are for patients who are refractory or where the medication has not worked.
Right.
But there are some cases where even injection of botulinum may not work. Then you need surgical. You need something to do surgery or something like that.
Right.
Sometimes it's spinal cord injuries. So there are times when we have to place in what is known as electrical nerve stimulation. We can use electrodes in the leg, or we can use even Cersei electrodes, or sometimes we have to put in a needle in the sacrum at the back, and we can use what is known as sacral neuromodulation. Now there was a time about more than a decade ago where these things were not available, so we used to do surgery. We used to augment the bladder. That means the bladder, we used to split the bladder open, take out part of the intestine, put over the bladder, and make the bladder.
So this is an augmentation.
Yes, augmentation of the bladder. But usually, in most cases, I would say about 18 to 90% of the cases, the medications now will work. But there may be some side effects, constipation and dryness of the throat. And there's certain contraindications. That means you don't use it for patients who has glaucoma or high pressure in the eyeballs. Then you don't use anti-muscarinics for overactive bladder.
So what's an artificial sphincter for?
Okay. See, there's some cases where the sphincter is completely incompetent, or
it can't contract.
It can't contract. So in these type of people, they have leaking 24 hours a day, irrespective of whether you cough, irrespective of whether you sneeze, even you're sitting down or lying down, it just leaks out. Now these are the type of cases where usually seen in certain prostatic operations for prostate cancer or certain spinal injuries where it only involve the sphincter alone. If that's the case, we put in an instrument. We put in an instrument into the bladder neck and the urethra, where it's something like a cuff. And then with the instrument, we have got a balloon, which is a reservoir, and a pump. And the pump, we place it near the scrotum. And whenever the patient wants to pass urine, all he has to do is press the pump, and it releases the cuff, which holds the sphincter, and they will be able to pass urine.
So is it a simple procedure?
It's not a simple procedure, but it's a reliable procedure.
Reliable procedure, which means after the procedure, how long does it take for one to convalesce and be able to get back to normal?
Within 4 to 6 weeks.
4 to 6 weeks, and you're back to normal.
Yeah, you're back to normal, but you have to always use the pump to pass urine.
I want to get into something now before I get into what I want to talk about. I want to get into something now that we like talking about a lot. Kidney stones. Malaysians, we love our kidney stones. Yeah, and I'm sure you have people who come and give you theories about kidney stones. You know, too much heat, so on and so forth. So tell us about kidney stones and what do we need to know about kidney stones?
Okay, that's very.
Even before the show, I got him to check me.
No, it's very important, very interesting to know. We are in the endemic stone belt for urinary stone formation.
Oh wow!
There's a belt which is known as endemic stone belt, which starts off from the Middle East right up to Myanmar, India, Malaysia, Singapore, Thailand, Philippines, and all.
Would you say it's a Malaysia Boleh moment?
In these regions, the stone rates, urinary stone rates are very, very high. You know why? It's probably maybe because it's a tropical country, you sweat a lot, you don't drink enough water, maybe your diet is different. You know, when I went overseas, I went to Bristol for training in urology, we used to do 1 stone case a week. There's a particular Tuesday that we use stone cases. But when I'm
Tuesday
in Malaysia,
was stone day.
Tuesday was a stone day. not where people get stoned. But in Malaysia, every single day when I was in government hospital, we used to do 10 to 12 stone cases a day. So that's how different it is. Now, this stone formation now is very important. If a patient was to ask me, okay, doctor, how do you prevent stones? Now I will have to explain why stone occurs. Then that's how you prevent stone. Same thing like a car accident. How do you prevent a car accident? You must need to know how it occurs. So okay, you have to wear a crash helmet or seat belt or airbag or ABS or something like that. So let's say you have a glass of water. You put in a lot of salt inside. You can get concentrated. You put more, you can get saturated. Then you can get super saturated. Once the glass of water is super saturated, no matter how much of salt you put inside, the crystals will form, aggregate and form back the salt. And that's what's exactly occurring in the patients with who has a urinary stone formation. Their urine is super saturated with uric acid crystals, calcium crystals, oxalate crystals, phosphate crystals and so forth. So the most important medication is
water.
Add in more water. So I always advise them to drink at least 2.5 to 3 liters of water a day.
Okay, here's the other thing. Now, this drinking of water. I know someone who drinks 5 large bottles of water a day. Now, there's also a concern that people may overdrink water, and a lot of people don't read about this. And I'm sure you can give us some insights on this. Over drinking water, when do we stop drinking water?
Okay, that's what I actually advise my patients, because once I tell them, some of the patients come in very giddy and tell me that they are passing urine every few minutes. Now, over drinking water is a very, very important thing if you never do. That's why there are few water drinking competition overseas where an individual can even pass away or can die also. Because they drink too much of water, the whole brain gets swollen. And when you drink water, the sodium levels are certain constant in the body. When you drink too much water, you're diluting the sodium. Once you dilute the sodium, the nerves get more irritable. They again get fits and convulsions. They first will start having headaches, then they start having visual disturbances, and then start having fits and all that. So for me, I will always advise an individual to drink at least maybe 2 to 2.5 liters of water a day. If you're a stone former, 2.5 to 3 liters water a day.
You've got some friends who are so proud of the amount of water they drink. They even brag to I go to the bathroom like 9 times a day and it's like glass, it's that clear. I'm sure you have friends who tell you that. And they're very proud of it. For some reason, I think sometimes we're doing it wrong. So if you're going to the bathroom too many times a day, you're overdoing it.
What I would tell my patients is, see, there are 2 different ways to know how much to drink. Or 3 different ways. Number 1, calculating at least 2.5 liters of water a day. Or number 2, if you're thirsty, you drink water. And when you go to the gym or you sweat a lot, you drink water. And number 3 is checking the color of the urine. The color of the urine cannot be orange or cannot be dark colored. Very mild yellowish color or clear color is just nice.
Okay, but if you wake up in the morning and it's dark colored?
If you wake up in dark color, means you're not drinking enough water the day previously.
Prior to that? Okay. So you have to make sure that it's not...
You have to drink adequate amount of water, but not excessive. Anything over excessive is not good.
Anything excessive is not good. So I hope that's advice for all of us. Now moving into something I want to talk about. People talk about an enlarged prostate. So apparently this term is wrong. Why is that?
This term is actually inaccurate. It may not necessarily be wrong. See, prostate enlargement, when we use the term for the layman people, because they do not understand what prostate compression is all about. See, we know very well where is the prostate at. The bladder is here. The prostate is just below the bladder. Now you have an enlarged prostate. You have a prostate very, very enlarged, but it doesn't compress the urinary passage. You will not have any symptoms. Prostate enlargement is just an anatomical term. Just how big a prostate is.
Enlargement in and of itself is not the problem, but it's the compression that it's causing.
So centrifugal enlargement is not a clinical problem. Centripetal compression is. So when they compress the bladder becomes very stressed. So the person passes urine very often, and you have a very slow flow of the urine. And some more, this prostate, that's why we call this as BPH, or benign prostatic hyperplasia. But there was a time when the urologists wanted to change the term, because many people are using the term prostate enlargement. So we wanted to change the term to BPO, or benign prostatic obstruction, to denote the term. But even then, when you have the symptoms, again, like overactive bladder is also a qualitative disease. It depends on the bothersome score. But it's very important. One of the first sign or symptom that one has with this prostate compression or BPH is getting up in the night to pass urine. At one time, we classified that significant symptoms as getting up to pass urine is known as nocturia of more than 2 times in a night.
Right.
But now we recognize that even getting up once in a night is also not good, because you cannot break your sleep.
Right.
There's such thing known as obstructive sleep apnea and sleep fragmentation and so forth.
How then do you hydrate yourself enough to not be able to experience nocturia?
In a normal person, even you hydrate yourself enough, they will not get up in the night.
Say if you take a full glass of water before going to bed.
You're not supposed to do that.
Not supposed to. See,
so
we learned something.
Don't overdrink. Yeah. So you want to finish the 2.5 liters of water a day. Try to drink in the daytime, or maybe in the evening, or maybe later in the night, but not just before you sleep. Yeah.
Right. Okay. Here's some of the frequently asked questions for Malaysians. Okay, we say like when something is wrong, they say your body is heaty, urine's dark, go drink barley.
Okay. Barley, the advantage of barley is no different from the advantage of water alone.
Okay.
There's only
there we have it.
There's only one thing that has made a difference. Only one solution containing citrate. So citrus fruits, that means orange, lime juice, lemon juice, limon nipis and all that. That's the only thing has been shown to reduce stone formation. Why? Because the citrate prevents aggregation of the crystals.
Right.
So if you ever ask for an advantage, it's not apple green ciders or not barley water.
Right. So this whole apple cider thing is a myth? Would you safely say it's a myth?
I wouldn't safely say it's a myth, but it's been propagated so much. You know why I will not, because there's no proper trials. And number 2 is apple. If you really go through the content of apple and grape, it has oxalate. Right. And oxalate can form stones. So the apple green cider thing, although it's all over the internet and all that, is not very specific.
Right.
It's not been proven to prevent stones.
Right. So you would be a proponent for putting a slice of lime in your glass of water.
If I'm a stone farmer.
Okay. If you're a stone farmer.
Yes.
Or not just plain water.
Plain water will do.
We've got about 1 minute left. Your message to Malaysia with regards to urinary tract health, and that's the camera. So maybe let's talk to all of us.
Okay. Urinary tract health, you need to drink adequate amounts of water. Don't overdrink. 2.5 liters of water is just nice. You have any urinary symptoms, getting up in the night to pass urine or poor flow, please see the doctor, because even though it's a qualitative disease, it is so bothersome it can affect your life as well.
Right.
And to live long, you have to live healthy enough, but you have to appreciate life for what it is.
On that note, Doc, it was a pleasure and an honor having you in the studio. Dr. Rajeentheran Suntheralingam, consultant urologist and urological surgeon from KPJ Damansara Specialist Hospital. It's a pleasure to have you in the studio. Stay with us. We're going to come back with more for you right here on Medical Today.